High earners in Scotland, apparently they could face a projected tax rate of 68%. This is basically going to be calculated. This is their new First Minister there. He wants to create this new tax threshold, basically, which would be a 44% bracket. And then when you start calculating, when you lose your personal allowance and stuff like that, it gives you that effective rate. That's what it's talking about. Let's talk higher taxes. Would you be in favour of these, Atul?
Higher taxes is a sign of a failing economy. I'm a Labour person. No one in their right mind wants to pay more tax than they need to. But given the position we're in, which is almost zero growth, probably in recession, the after effects of decades of austerity where our public services aren't working, an ambulance doesn't come if you're ill. When you get to the hospital, you're stuck in A&E.
What caused the need for austerity?
What caused the need? Well, the answer there is that we didn't actually need austerity on that scale. We didn't need to cut tens of thousands of doctors, nurses, police officers, which have left us stripped to the bone, which mean our public services aren't working. The point on tax, the reason tax is high right now, is that we've had no growth, and because everything was stripped to the bone in past years, even to keep the basics running, tax is rising. Now, if we are going to have, if as a country we choose to try have a health service, a national health service, based on, where an ambulance does pick you up, where when you call the police, someone does come and the crime is solved, that costs money and someone's got to pay. And ultimately, it's better, we kind of, windfall tax on utilities, find other areas for taxing. But if it comes down, in the end, it's people that pay tax. And if the choice is low income, middle income or high income, if it needs to be more tax in the short term from one group, better high income than low income.
So do you think it's fair? So the group that you're saying, so the higher incomes, and you just referenced the health service, these people are more than likely, let's face it, going to have private healthcare. So they're not really going to be using the health service that you mentioned, except, of course, in emergency scenarios. So do you think it's fair that they are the ones that have to pay more for a service that they will use far less?
Yeah, I think it's fair because we all live in this country, we pay tax. Our tax isn't sort of narrowly hypothecated and we're paying X for this and Y for this. It's not the same as going to go into a shop.
But the top 1% pay 30% of all income tax revenues, apparently, and apparently that is a higher share than any time in about, 20 or so years previously.
But that's part of these are the costs of failure. This is, if we don't have an economy that's growing, this is what happens. And if we're going to have, even in the short term, to get through this, if someone's going to have to pay, better it be the people at the top, because when you get to middle incomes, when you get to low incomes, the marginal rates of tax, so someone who's having benefits withdrawn, or even for people on middle incomes where they've got student loans going out, you've got all sorts of inflation going through the roof, there's no disposable income there. We're being squeezed.
Tax them till the pips squeak. Connor, what do you make?
You are going to make me bite through my tongue waiting for that to finish. I love how austerity is always trotted out. By the way, not a big fan of the austerity policies that were done. Counting the police officers, as we said earlier, was a disastrous idea. But as you alluded to, there were some factors before the Cameron government came in which caused the economy to be in a complete downturn. And what we've got at the moment is a money system problem. Now, we've had massive quantitative easing, which means money printing for people not versed, during the pandemic to subsidise furlough. And this was done by the current Prime Minister, who was then the Chancellor, and supported by the current Chancellor, who was not in Cabinet but wanted lockdown to be longer and more support. And the problem we have is, obviously, Gordon Brown decided to ditch the rest of the gold, so we don't have anything backing our money, so the money just gets majorly inflated. And so the issue we have is major spending.
Inflation is down to UK policy? Are you saying the inflation rate in this country is exclusively down to UK
Not
policy?
No, I didn't say exclusively, but quantitative easing is a huge contributing factor to inflation, isn't it?
We've had quantitative easing basically consistently since 2008. Our inflation, though, is driven by the COVID supply shock. In this country, partially supply shocks related to
I'm sorry,
to
are you really going to say that? So, US Federal Reserve did this as well. About 60% of all the dollars in existence were printed during the pandemic period, and you're saying that's not going to have a problem as it's flowing through the money system?
The supply shocks is what's driving inflation in this country. It's not wages necessarily. It's not. It's the basically we are bidding more for things
by excessively printing money. They have done that.
It is the absence of supply of goods that is driving inflation in this country. That's why raising interest rates is pointless.
Are you saying it's exclusively? And by the way...
Principally. Because we had quantitative easing since 2008 up to...
But you was a fan, wasn't you, if I remember our conversation previously correctly, you was a fan of prolonged lockdowns. You supported that as a policy.
Completely.
But then this is what you get. When you lock down countries' economy for a sustained period of time, this is then what you get. This is one of the side effects of it, whether it's printing money to help people sit at home and hide away from things. This is the outcome.
Basically, one has a choice of two evils. Hundreds of thousands of people dying.
Which were never going to happen.
Well, I think
that's factually untrue.
Well, you may say it's factually untrue. I would choose to believe the chief medical officer and
the models were consistently wrong. They omitted factors from it. If you look at countries that didn't lock down in American states,
with respect, neither of us are medical professionals. But I will go with the judgment of the overwhelming majority, 95% plus.
You happen to know what
the leaders of our medical world.
So the four studies they based the mask policy on. One was a small-time survey from a non-graduate student, only written in Chinese. And it was of about 14 people. And that's one of the studies they used to justify the mask policy for the whole of Britain. So I don't care who says it, I care about the data and the evidence, and looking backwards, which policies were more successful. Yours was a disaster.
I cannot believe that we're having this discussion, whether it's Chris Whitty, whether it's Patrick Vallance, whether it's all of these eminent physicians. The idea that they would engage in a conspiracy to deliberately hoodwink the country, and they're all in on it all together, strains credulity beyond belief. It is extremely hard to do the basics, let alone organise a global international conspiracy. To think that they would do this requires an infrastructure of deception and coordination, which is leagues beyond anything that a government can manage.
News Initiative and the fact that the majority of people that fund the WHO are the exact kind of people you're talking about, and they decided to say that China did not have peer-to-peer transmission and that it didn't come from a lab, which it eventually did. We have the receipts of all of the cover-ups.
So you think there is a global conspiracy involving all of the governments, all of the medical establishments, and literally hundreds of thousands of civil servants around the world and people, including Republicans in the US, including people across the EU. You think that conspiracy has... that data was suppressed, and because of that conspiracy, we are in the state we are. That is for the birds. That's nuts.
Well, we don't have birds, but we do have breaks. So you can be the birds at home. He says it's for the birds. This is something Conor obviously feels very strongly in. I do have to say, by the way, when it comes to the lab thing, there are differences of opinions. I do have to say that.